I'm going to talk about Medicare Part A, and this is the first piece of Medicare, so really important that we understand it, so stay tuned. Okay, let's now talk about the different parts of Medicare. And I know most people think at this point, why do there have to be parts of Medicare? Why can't it just be Medicare? It is broken down into pieces, and there's different reasons for that, but I'll show you, and it's really not that complicated. We just need to kind of get an understanding of it, and then once you understand it, it's pretty simple to kind of navigate after that point. So when we're talking about the different parts of Medicare, we talk about Part A, Part B, Part C, Part D, and then we'll add an extra one in there, Medicare Supplement or Medigap Plan. So these are the different parts of Medicare, and not so complicated, but they kind of make it a little confusing. Part A is pretty much inpatient care. Part B is outpatient care. Part C is completely different. Maybe that's why it's for C. Part C is Medicare Advantage, which takes you kind of off of original Medicare and put you with an insurance carrier in their Medicare Advantage plan. Part D makes a little bit of sense. It's for drugs, so there's a Part D drug plan. And then Medicare supplements cover what A and B do not. So we're going to break it down as we go, but right now we're just going to talk about Medicare Part A. So this is obviously the first piece. Want to make sure you understand it completely. And it's really not that complicated. We just need to get a clear picture of it. So Part A pretty much covers what happens inside the building. So it's inpatient care. So Part A covers you when you go into the hospital for inpatient care. Part B covers outpatient care, the doctors and outpatient services not inside the hospital. So that's kind of what Part A is. Now, in understanding Part A, it pretty much comes automatically to you, so you don't really have to do anything to sign up for it. When you turn 65, your Part A is pretty much going to be there. There's generally no cost to Part A as long as you have paid into your Medicare taxes throughout your working lifetime, and the line is at either 30 quarters or 39 quarters. So if you've paid your Medicare taxes like the majority of us have, then there's no cost for Part A. You can see the cost here if you have not reached those limits on your taxable contributions. And then once you have Part A, if you go into the hospital, there is a deductible. So there is a $1,340 deductible. So if you're admitted in the hospital, you're immediately responsible for that $1,340 deductible. Now that is something that a Medicare supplement plan would likely cover. So keep that in mind. So even though you have it on Part A, you'd probably have a supplement that's going to pick it up. So you have that $1,340 deductible, and it's per benefit period. And a benefit period is a 60-day period of time. So if you were admitted in the hospital and then you're discharged, if you're readmitted within that 60-day window for the same condition, you would not have another deductible. If you were readmitted 62 days later, you would be responsible for that $1,340 deductible again. So you can see you can have that deductible multiple times during the year. So if you were readmitted in that 60-day window for a different condition, you'd also be responsible for that deductible again. So keep that in mind. You can see the cost per day in the hospital after the deductible. Day 1 through 60, it's pretty much just the deductible. There's no cost to you after that. 61 to 90 goes up to $335 a day. So pretty significant on the cost. God forbid we're in the hospital for more than 2 months. We're going to also have a big bill when we come out. Now, if we're there for 3 months, it gets really big. So it goes then to $670 per day after 90 days, but it's pretty rare to be in the hospital that long. You might be transferred to a skilled nursing facility, and that's a different subject, skilled nursing facility, where you have coverage for up to 100 days, and then you don't have coverage after that. So you need to understand your skilled nursing facility as well. But this kind of gives you Part A at a glance on what the out-of-pocket expenses are. If you want to get a little deeper into what exactly does it cover, and it's pretty much regular health insurance, so medically necessary stuff. But if you need to know, how many pints of blood or ambulance services or things like that, this is the Medicare Guide, and I'll show you in just a minute where you can download it and you can keep it on your computer, and nice to have, and you can look up anytime you need it. If you are ever admitted into the hospital, you'll know exactly what you're talking about. So obviously this is what I do, is I help people with their Medicare choices. So I'm an insurance broker, and I help people primarily with their Medicare supplement choices. and there's no cost to use me to help you. So I certainly hope you'll allow me to help you, and it's pretty easy. And I work currently in 49 out of 50 states. So I would assume most of us will be in 49 out of those 50 states. So you can visit my website, MedicareOnVideo.com. I've got a lot of information there that might be helpful to you. You can immediately get a quote for your Medicare supplement coverage so you know exactly what it costs where you live. You could also download a free discount prescription drug card. So if you click right there on that discount prescription drug card, you can download it on your computer. Hopefully it'll save you a few bucks on your prescriptions in the future. And then I've got a lot of stuff in my resource center. So I have a whole guides and forms section. If you click on the resource center, it'll drop down. You can see a bunch of my videos. You can go into the guides and forms. And this is where you can find a lot of things. And this is where you can find that benefit guide for Part A. So you can download it right here. You just click on it. It'll go onto your computer or your iPad, and you'll have it from now on. So while you're here, look around. There's a lot of good stuff. If you are coming off a group plan at work, you're going to need this employer coverage form that your employer has to fill out so you can get your Part B without a penalty. So make sure if you're going to retire and you're already past 65, do this well ahead of time. Get this form, send it to your HR department, get them to fill it out. That way you won't have any trouble when you come into Medicare. You can also download a copy of my book. I actually have a book called Medicare Made Clear. A lot of good information there, and again, something you can keep on your iPad or your computer and reference whenever you need it. So a lot of good information there, so feel free to look around the guides and the forms. If you want to see more of my videos, really the best place is on YouTube, and tried to make it easy for you to get there. If you go to www.keithvideos.com, it's going to bring you right to my YouTube channel. You can see right now I just passed 8,000 subscribers on my YouTube channel, so pretty exciting that we have that many subscribers. But I put out videos all the time, and it'll be fun to watch that grow. Depending upon when you come, we'll see where that number goes. If you want to search videos, just use this magnifying glass, and you can put in whatever topic you're looking for, and it'll bring up videos on that topic. Part A, Part B, Part D, Part C, whatever it may be. It'll bring up whatever videos correlate to that topic. So I hope you found this helpful. And again, I would appreciate it if you let me help you with your Medicare supplement. That's how I make my living. I do not work for an insurance company. I work on your behalf, and we make sure we get it right the first time. So I'll make sure to get all your pieces in the right places, and that way we'll have no worries and no surprises down the road. So I hope you found this helpful, and I'll look forward to helping you, and have a fantastic day.